Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. As you know, I already started to upload individual theory explanation videos and already uploaded a complete video of psychosexual theory with all child dental examples. Second theory is psychosocial theory or the theory of developmental task by Eric Erikson. So stay tuned for all theories of child psychology. What is the meaning of psychosocial? So psycho means mind or psychological development, and social means relationship and society. So psychosocial means how your mind develops through social experience. We already seen psychosexual theory means a theory about how the mind develops through stages of pleasure and desire, and in psychosocial theory how your mind develops through social experiences. So Erikson believed that as we grow we face 8 life stages, each with a psychological conflict like trust versus mistrust or identity versus role confusion. How we handle these challenges shapes our personality and emotional health. So Eric Erikson, psychoanalyst, proposed the psychosocial theory of development in 1950. He expanded upon Freud's psychosexual stages by emphasizing social and emotional development across the entire lifespan. His theory includes 8 stages, each representing a psychosocial conflict, which is trust, mistrust, that must be resolved for healthy development. Failure to resolve a conflict leads to environmental struggles and influences behaviors, including in dental environments. It includes 8 stages. Stage 1 is infancy, which is in age 0 to 1 year, and the crisis is trust versus mistrust. Here, crisis means a challenge or conflict that must be resolved for healthy development. So, in the first year of life, infant depends on others for food, warmth, and affection, and therefore must be able to blindly trust parents for providing these things. Each stage has a positive outcome and a negative outcome. So, in stage 1, positive outcome is if their needs are met constantly and responsively by the parents, infants not only will develop a secure attachment with the parents but will learn to trust their environment in general as well. But if their needs are not met constantly and responsively, then infant will develop mistrust towards people, environment, and even towards themselves. How it apply in dental clinic or dental environment or dental chair. So these stage identify with the development of separation anxiety in the child, because the child is so small. If necessary to provide dental treatment at this early age, it is preferable to do with the parent present and preferably with parent holding the child. So when a child separated from their caregiver, especially in an unfamiliar places like a dental clinic, they may feel fear and insecurity. That's a separation anxiety. So if a dental procedure happens during this sensitive phase without the parents nearby, the child might interpret the situation as I am not safe or my caregiver has left me, which can deepen the mistrust. Stage 2 is toddler, which is in age 1 to 2 years, and crisis autonomy versus doubt. So autonomy means the ability to make your own choices and control your own actions without being forced or controlled by someone else. So toddler learn to walk, talk, use toilets and do things for themselves. Their self-control and self-confidence begin to develop at this stage. So if parents encourage their child's use of initiative and reassure him when he makes mistakes, the child will develop the confidence needed to cope up with the future situation that require choice, control and independence, and the child will develop both self-control and self-esteem. But if parents are overprotective or disapproving of child's act of independence, he may begin to feel ashamed of his behavior or have too much doubt of his abilities. If you are not patient enough to wait for your child to tie his or her shoelaces, your child will never learn to tie them and will assume that this is too difficult to learn. So how it affect dental environment? So child wants to hold the mirror, climb the chair themselves or say no, and may resist suggest brushing or opening mouth on command. Offer guided choices like, do you want the red brush or the blue one? And always encourage the participation, because it will develop the self control and self esteem. Coming to the stage 3, which is early childhood, in the age of 2 to 6 years, and the crisis is initiative versus guilt. Children have a newfound power at this age as they have developed motor skills and become more engaged in social interactions with the people around them. Motor skills are the ability that allow us to move and control our bodies to do everyday tasks like walking, writing, even brushing our teeth. So they come into two main types, like gross motor skills and the fine motor skills. So gross motor skill include the big movements using large muscles like arms, legs, torso, and the movements are like crawling, jumping, running, climbing. And fine motor skills are the small precise movements using hands and fingers like holding a pencil, buttoning a shirt, tying shoelaces. So they now must learn to achieve a balance between eagerness for more adventure and more responsibility, and learn to control the impulses and childish fantasies. So if parents are encouraging but consistent in discipline, children will learn to accept without guilt that certain things are not allowed, and at the same time will not feel shame when using their imagination and engaging in make believe role plays. If these things are not done by parents, children may develop a sense of guilt and may come to believe that it is wrong to be independent. So in dental clinic, child may ask questions about instruments or pretend play dentist at home, may also feel guilty if they think crying is bad behavior. So in these cases, use tell show, do role play with the puppets, and praise attempts at cooperation. Coming to the stage 4, elementary and middle school years, which is in age 6 to 12 years, the crisis is industry versus inferiority. So here industry means child's growing sense of competence, productivity, and ability to achieve goals. So at this stage, school become very important. So at 6 to 12 years, children learn to build things, use tools, and develop skills for future work. They start moving from the world of home to the world of friends and peers, and they begin preparing for life in a competitive world where peers matters more and parents become less central. So if children can discover pleasure in intellectual stimulation, being productive, seeking success, they will develop a sense of competence. But if not, if the child is allowed too little success because of example harsh teachers or rejecting peers, then he or she will develop a sense of inferiority or incompetence. We can say this inferiority complex. So in dental environment, when child wants to show how brave they are or compare behavior to siblings, classmates, also may feel inferior if scolded or unable to control fear, you should always use positive reinforcement, give reward charts, and peer comparisons carefully. Coming to the stage 5, adolescence stage, which is at the age 12 to 18 years, and the crisis is identity versus rule confusion. So this is the stage when we begin to ask, who am I? According to Erickson, this is the key time to develop a clear personal identity. Teens try to combine what they have learned in the earlier stages like trust and independence to build a sense of self. They start to feel like they belong to a group but also realize they can be independent from their family. Changes in the body, emotions, school life, and future goals make this stage complex. Friends and peer groups become more important while parents' views may be questioned or rejected. So, if teens resolve this stage well, they gain a strong, confident sense of who they are and what they believe in. But if not, the adolescent will sink into confusion, unable to make decisions and choices, especially about vocation, sexual orientation, and his role in life in general. In your dental clinic, teen may become self conscious about braces, smile, or speech, may reject reject treatment recommendations as a form of asserting identity. So involve them in decision making, discuss aesthetic outcomes, and respect privacy. Coming to the stage 6, young adulthood, which is 19 to 40 years, and the crisis is intimacy versus isolation. In this stage, the most important events are love relationship. No matter how successful you are with your work, said Erickson, you are not developmentally complete until you are capable of intimacy. Successful development of intimacy depends on a willingness to compromise and even to sacrifice to maintain a relationship. An individual who has not developed a sense of identity usually will fear a committed relationship and may retreat into isolation. The adult individuals can form close relationship and share with others if they have achieved a sense of identity. Success leads to the establishment of the affiliations and partnerships both with a mate and with others of the same sex in working towards the attainment of career goals. If not, they will fear commitment, feel isolated, and unable to depend on anybody in the world. Failure leads to isolation from others and is likely to be accompanied by strong prejudices and a set of attitudes that serve to keep others away rather than bringing them into closer contact. So, in your dental environment, patient may affect dental anxiety, especially in partners or college students starting independent dental visits, may delay treatment due to social fear or isolation. So, establish a trust based provider relationship, build a rapport during case discussion. Coming to the stage 7, which is middle adulthood at the age 40 to 65 years, and the crisis is creativity versus stagnation. So stagnation means a lack of movement, growth, or progress when something stays still or becomes inactive. So by generativity, Erickson refers caring for others and helping the next generation through parenting, teaching, and community support is the creativity. So its opposite is stagnation, where adults become self-centered, uninterested in helping others. So people can solve this crisis by having and nurturing children or helping the next generation in other ways. But negative outcome is people will remain self-centered and experience stagnation later in the life. So adult patient may prioritize family's oral health over their own. Dentist at this stage may mentor younger colleagues or train staff, promote family education and community oral health efforts. And the last stage is stage 8, late adulthood, which is at the age 65 years to death, and the crisis is integrity versus despair. So old age is a time for reflecting upon one's own life and seeing it filled with the pleasure and satisfaction or disappointments and failures. So the positive outcome is if the other 7 psychosocial crises have been successfully resolved, the mature adult develop the peak of adjustment, which is integrity, and if the adult has achieved a sense of fulfillment about life and a sense of unity within himself and with others, he will accept death with a sense of integrity, just as a healthy child will not fear life. But in negative outcome, the opposite of this is despair. This is often expressed as disgust and unhappiness on a broad scale. So elder patients reflects on life, including regrets or acceptance, may face loss of dentition and function, provide compassionate care, reinforce the value of quality of life, and address emotional needs. But there are limitations of Erickson's theory. The first is the cultural bias. Based on Western individualistic societies, less valid for collectivist cultures. The second is stage rigidity, assumes fixed age periods, development can be non-linear. Gender generalization, so critics like Carol Gilligan argued that the theory reflects male development more. The fourth is lack of empirical basis, so concepts are not always scientifically measurable or testable. And the fifth is emotional oversimplification, so real life emotions are more complex than binary conflicts like trust or mistrust. No, there are more things other than trust and mistrust, or there are lots of things in between trust and mistrust. These are the references. If you want this PDF or any other PDFs, just like, subscribe, and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. We also put image based MCQ in pediatric dentistry in our shorts, and we'll put lots of other types of MCQs related to pediatric dentistry. So press the bell icon for every update. Like, share, subscribe. Thank you.